As a heart surgeon with decades of experience, I've seen firsthand how the smallest habits, what we eat, how much we move, and even how we sleep, can influence our heart health in powerful ways. But among all the things that silently affect the heart, one category stands out more than most, especially in people over 60. Medications. Every week I meet older patients who are troubled by fatigue, swelling, chest discomfort, shortness of breath, or irregular heartbeats. Often they believe these symptoms are simply part of aging, or perhaps a consequence of diet or emotional stress. But after years of treating thousands of patients, I can tell you with confidence, there's a hidden culprit we often overlook: prescription and over-the-counter drugs. And no, we're not talking about dangerous street drugs or medications taken irresponsibly. These are legal, widely used drugs that millions of people over the age of 60 take daily, some for blood pressure, others for pain, sleep, digestion, or even minor infections. The problem is, while these medications are often effective for their intended purposes, they can quietly damage the heart in ways that go undetected until it's too late. In this video, I'll walk you through 7 common medications, ones that may already be in your cabinet, that could be harming your heart without you even realizing it. But let me be very clear. This video is not about creating fear. It's about raising awareness. You should never stop taking any medication without first talking to your doctor. But knowledge is power, and understanding the hidden risks behind certain pills can help you protect your heart and live a longer, healthier life. Let's begin with the 7th pill on our list, one that many people take for pain relief. Pill 7, non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs, or non-steroidal anti-inflammatory drugs, are incredibly common. You've likely taken one at some point: ibuprofen, naproxen, or aspirin. These medications are often found in homes around the world and are used to manage everything from headaches to joint pain to backaches. But when it comes to older adults, especially those with any degree of heart weakness, NSAIDs can quietly cause serious harm. These drugs increase blood pressure, cause fluid retention, and may even directly affect the heart's ability to function properly. In other words, the very medication you take to feel better could be placing extra stress on your heart. How does this happen? NSAIDs interfere with chemicals in the body called prostaglandins. These chemicals help regulate blood flow to the kidneys. When their function is suppressed, kidney performance declines, leading to fluid buildup in the body. This extra fluid makes the heart work harder, and in someone over 60, especially someone with a heart condition, that added strain can trigger heart failure or worsen an existing one. Furthermore, NSAIDs can reduce the effectiveness of blood pressure medications and diuretics, creating a dangerous cycle. You take a pill for pain, but it neutralizes the pill you take for your blood pressure, which causes your pressure to rise and your heart to suffer. So if you're taking NSAIDs every day to manage arthritis or chronic pain, it's time to speak with your doctor about safer alternatives, like topical treatments, physical therapy, or other less harmful pain relievers. Pill 6, diabetes medications, thiazolidinediones, TZDs. Next up are certain diabetes medications, specifically a class called thiazolidinediones, or TZDs. You may recognize them by the names pioglitazone, Actos, or rosiglitazone, Avandia. These medications work by improving insulin sensitivity, helping your cells absorb sugar more efficiently. But here's the catch. They also promote fluid retention, and just like NSAIDs, that extra fluid makes the heart work harder. For seniors, this can quietly lead to congestive heart failure, especially if they have any prior heart issues. What makes TZDs especially dangerous is that their side effects often mimic normal aging. Fatigue, swelling in the ankles, and shortness of breath are easy to dismiss when you're in your 60s or 70s. But in reality, these may be signs that your heart is struggling, burdened by the very medication intended to help another condition. If you're a senior taking a TZD and have noticed even mild swelling, fatigue, or difficulty breathing, don't wait. Ask your doctor to reassess whether this medication is still the best choice for you. There are newer diabetes drugs that don't carry the same heart risks. Pill 5, sleeping pills, sedative hypnotics, and benzodiazepines. Now let's talk about sleeping pills. Insomnia is a common complaint among seniors, and understandably so. Sleep patterns change with age, and falling asleep, or staying asleep, can become more difficult. But many people turn to medications like zolpidem, Ambien, temazepam, or even older benzodiazepines like diazepam, Valium for help. These sedatives work by depressing the central nervous system. That may help you sleep, but it also slows your breathing, reduces your heart rate, and can interfere with oxygen flow during the night. And here's where the danger really lies. Sedatives are strongly linked to sleep apnea, a condition in which breathing repeatedly stops and starts during sleep. These pauses can deprive your heart of oxygen, causing nighttime surges in blood pressure, irregular rhythms, and even nighttime heart attacks. The risk is even greater if you're already taking medications for blood pressure or heart rhythm, as sedatives can reduce their effectiveness or create dangerous interactions. Plus, sedatives increase fall risk, mental fog, and daytime drowsiness. Issues that, again, are more dangerous for seniors. If you rely on sleeping pills nightly, it's time to reconsider. Cognitive behavioral therapy for insomnia, CBTI, meditation, melatonin, and improved sleep hygiene are all safer, long-term strategies to restore restful sleep without jeopardizing your heart. Pill 4. Tricyclic antidepressants. Next on the list are tricyclic antidepressants, an older class of drugs used for depression, anxiety, and even nerve pain. Names like amitriptyline and nortriptyline may sound familiar. While effective in some cases, these medications can wreak havoc on the heart's electrical system. They've been associated with arrhythmias, fluctuations in blood pressure, and even heart block, where the electrical signals that regulate your heartbeat are delayed or interrupted. Older adults are especially vulnerable because aging naturally slows electrical conduction in the heart. Tricyclics can amplify this issue, potentially leading to slow heartbeats, dizziness, or fainting. They also cause dry mouth, constipation, blurred vision, and confusion, all of which increase the risk of falls. Despite these risks, many people continue to take tricyclics because they were started years ago, and no one has reevaluated the prescription. If that sounds like you, don't stop taking it abruptly, but definitely discuss alternatives with your provider. Today, there are newer antidepressants that have fewer cardiovascular side effects. Pill 3, decongestants, pseudoephedrine, and phenylephrine. When you catch a cold or your allergies flare up, it's easy to reach for decongestants like pseudoephedrine, Sudafed, or phenylephrine. These are found in hundreds of over-the-counter cold and allergy medications. But decongestants work by constricting blood vessels, including those in your heart. This raises blood pressure, increases your heart rate, and can even lead to arrhythmias. For seniors who may already have hypertension or reduced cardiovascular resilience, the effects can be dangerous. Even a short-term use of these medications can lead to palpitations, dizziness, or spikes in blood pressure. If you're already taking heart medications, adding a decongestant can be a dangerous mix. Instead, consider using saline sprays, a humidifier, or antihistamines that don't elevate your heart rate. Always check the label before taking cold medication, and if you have any heart condition, avoid decongestants unless explicitly approved by your doctor. Pill 2, proton pump inhibitors. PP is like omeprazole, Prilosec, and pantoprazole. Protonics are used by millions to manage acid reflux and GERD. They reduce stomach acid, bringing relief to those plagued by heartburn. But long-term use can interfere with the body's absorption of key nutrients, especially magnesium. Low magnesium levels are a major concern for the heart. They can lead to muscle cramps, palpitations, and dangerous arrhythmias. Additionally, PPIs can disrupt gut flora, increase inflammation, and may raise your risk of stroke and kidney disease, all of which indirectly affect heart health. PPIs are intended for short-term use, typically a few weeks to a few months. If you've been taking one for years, it's time to reassess. Lifestyle changes like dietary adjustments, elevating your head at night, and avoiding trigger foods can provide lasting relief without compromising your heart. Pill 1, calcium channel blockers. And finally, the #1 medication that may be silently harming your heart, calcium channel blockers. Drugs like verapamil, diltiazem, and amlodipine are prescribed to manage high blood pressure and certain types of chest pain. They work by relaxing blood vessels and reducing heart workload. But in older adults, they can sometimes slow the heart too much. This can lead to fatigue, swelling, dizziness, or even worsening symptoms of heart failure. Some calcium channel blockers cause fluid retention, which over time makes the heart pump harder and increases the risk of edema and shortness of breath. The biggest issue? These drugs are often prescribed and forgotten, used for years without any review. If you're on one and notice new or worsening symptoms, don't assume it's aging. It may be your medication. Final thoughts. Every medication has a purpose, but your body at 65 isn't the same as it was at 45. Aging affects how we metabolize drugs and how sensitive we are to side effects. Medications that once served you well might now be slowly hurting you. If you or a loved one is over 60 and taking any of the medications listed, do not make changes on your own, but do have a conversation with your doctor. Ask for a full review of your medications. It might be the most important step you take for your heart. Use tools like the Senior Health Tracker app to monitor symptoms, track medication effects, and catch early warning signs before they become serious problems. Because your heart matters, and you deserve to protect it with every beat.